How do we treat a pinched nerve in the lower back without surgery? Living with leg pain, lower back pain, or the debilitating symptoms of a pinched nerve can feel like an uphill battle. It affects your ability to enjoy life, it limits your mobility, it can even lead to feelings of helplessness. If you've tried treatments like physical therapy, medications, or injections that have failed to provide relief, then this will be an important video for you. In this video, I'm going to show you how to treat a pinched nerve in your lower back without surgery using a unique combination of two research-backed treatment methods. In addition, I'll clarify the meaning of a pinched nerve in the lower back versus lumbar radiculopathy versus sciatica, all without using the complex medical jargon. Understanding this is crucial for avoiding misdiagnosis, for reducing worry, and making informed decisions about effective treatments. Be sure to watch until the end of the video because missing any part could be the reason your condition becomes chronic and you don't get the relief you want. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. I've been doing this for over 30 years now. My YouTube channel focuses on helping those who've been suffering with debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash the subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and without surgery. I upload a new video every week. In addition to that, I've created a free health vault. It's a collection of exclusive videos that get delivered to you each week with trusted health knowledge and lifestyle hacks. You can get it at the link in the pinned comment below. A pinched nerve in the lower back is also known as lumbar radiculopathy. In fact, the two terms are often used interchangeably. The word radiculopathy comes from Latin, so let's make this really simple for you. From Latin, the first part of the word comes from radix, which really means root. So what we're talking about in this case is we're talking the root of the nerve. And pathia, or pathos, pathia means suffering. Pathos really means disease. So essentially it means disease or suffering of the nerve root. A pinched nerve or radiculopathy occurs when nerves in that lumbar region are compressed, they're irritated, they can cause excruciating leg pain. People often think of a pinched nerve where there has to be actual pinching on the nerve. That's a bit of an oversimplification. That can come from compression, that can come from chemical changes, that can come from so many different things, but all of these things are causing disturbance or interference to that nerve. So this condition often involves what we call the L4, the L5, the S1 nerve roots, and they exit the spinal column in the lower back. So let's dive into each of the nerve roots. Appreciate that whether you believe in God or Mother Nature, whoever invented the spine and the nervous system did this incredible job where the spinal cord wants to stay inside the spine for as long as possible for protection. And so a nerve that's going to the shoulder is going to exit the neck. A nerve that's that exits out of the lower back is going to things in that region and also coming down the legs. So when a nerve exits at L4, the radiculopathy symptoms that come with that, your pain is typically going to radiate from the lower back to the front of the thigh and also into the knee. You're going to get weakness in the quadriceps. So the quadriceps are the big muscles on the front of the thigh. That can affect your ability to straighten the knee as well. You're going to get numbness around the knee or along the inside of the calf as well. And you're going to reduce your reflexes if it becomes significantly irritated, particularly what we call the knee jerk reflex. So that's when you see, the doc take the hammer and hit you right on the patella tendon, and you'll see the leg go up. The nerve that exits from L5 takes a slightly different path, and please appreciate there is some overlap in this as well. So L5 radiculopathy symptoms, the pain is going to spread from the lower back down the outer side of the thigh, often into the calf and sometimes the top of the foot. You're going to get weakness in the foot and the big toe, which can lead to difficulty lifting the foot. That's what's referred to as foot drop. Numbness can be along the top of the foot and the web space between the big toe and the second toe. For S1, so remember lumbar, there were 5 vertebrae and we number them 1 through 5. S1, that's the first of the sacral vertebrae, but again, the sacrum is fused together. So S1 radiculopathy symptoms, pain is going to radiate down the back of the thigh, into the calf, often extending into the sole of the foot. So now we're on the bottom of the foot. Weakness can affect the muscles that allow you to push off with your foot. So that's what we call plantar flexion. So for instance, walking on your tiptoes would be difficult. Numbness can be experienced on the outer edge of the foot, and you can get reduced reflexes again, particularly what we call the Achilles tendon reflex. There are really 5 main common causes of lumbar radiculopathy. Number 1 is what we refer to as a disc herniation or disc bulge. So remember, when we're looking at the vertebrae, you've got a vertebrae, you've got a nice thick disc, there'll be another vertebrae, another disc, another vertebrae. The yellow guys you see coming off here, those are the nerves. They're coming right through these openings in between the vertebrae. They come straight off the spinal cord, which is inside the spinal canal. What happens in a disc herniation is you're now taking those discs, and those discs are now starting to bulge out, if you can see that right there. And when that disc bulges out, that's obviously going to be putting pressure on that nerve. Those discs can bulge out backwards, they can bulge to the side, they can bulge what we call centrally and so forth. And when you have that, it's going to cause that radiculopathy because it can even leak and put pressure on that nerve. The second thing, most common cause of lumbar radiculopathy is what we call spinal stenosis. So let's get back to that same vertebrae. And if we look at it from the top, that's where that spinal cord is. That goes all the way up to the brain. And it's that opening where the spinal cord comes through. Well, lumbar stenosis, again, people try to make this way too complicated. Stenosis just means narrowing. So if I've now narrowed that canal where the spinal cord is, again, I'm likely to then put compression on the entire spinal cord. So that obviously can also compress the nerves as well. Number 3, you have what we call neuroforaminal stenosis. So the neuroforamen, that's the actual opening where the nerve is coming out, where that nerve root comes out. And so again, in this type of stenosis, you're now actually enclosing that opening. And if you enclose that opening where the nerve is exiting, again, what a surprise, you're going to be putting pressure on those nerves. That can compress the nerve roots, and again, it's going to cause that radiculopathy. Number 4 and number 5 are really from the same vein, and it's what I call spondylolisthesis, or what is known as spondylolisthesis. And it breaks down really into 2 different categories. So spondylolisthesis, if we look at the vertebrae from the side, spondylolisthesis is the vertebrae can either shift forward or backwards, and if they're shifting, okay, again, if there's a shifting where one vertebrae moves relative to the other, again, it's going to compress the nerve. So anterior listhesis just means relatively the one is moving forward compared to the other, and retrolisthesis means that one is moving backwards relative to the other as well. So when we do that, when we have that displacement of vertebrae, that's typically caused by some type of injury or accident, because there are strong ligaments that hold that in place, and you need enough force to overcome that to cause that spondylolisthesis. That not only puts pressure on those nerves that can cause that radiculopathy, where they're exiting at the foramen, but it can also then tense that spinal cord if we actually have that shift into the vertebrae as well. So then what is the difference between radiculopathy or pinched nerve and sciatica? Well, radiculopathy and sciatica are terms that are often used interchangeably, but they actually do describe different conditions. So radiculopathy refers to symptoms caused by compression or inflammation or injury to that nerve root in the spine. So when this occurs in the lumbar region, as we said before, it can affect the L4, the L5, the S1 nerve roots, leading to pain, numbness, and weakness in specific areas of the leg and the foot, depending on the nerve root involved and where that nerve goes to. Radiculopathy can be caused by various issues, such as disc herniation, spinal stenosis, or other degenerative changes in the spine. Sciatica, on the other hand, specifically refers to pain that travels along the sciatic nerve. So that runs from the lower back through the buttocks and down each leg. True sciatica occurs when the sciatic nerve is compressed or irritated, most commonly at what we call the piriformis muscle in the buttock. We've talked about that before. So this muscle can spasm and compress the entire sciatic nerve, causing pain that typically radiates down the leg and can reach the foot. However, it's important to note that any form of leg pain resulting from lumbar nerve compression or irritation along the sciatic nerve's pathway is often commonly referred to as sciatica. This broad use of the term can sometimes lead to confusion. True sciatica is specific to tissues involved in the sciatic nerve itself, whereas radiculopathy encompasses a broader range of nerve root compressions in the spine, although they can lead to similar symptoms. What matters most in effectively treating leg pain is accurately identifying all of the underlying causes. Leg pain can result from a variety of issues, like I mentioned earlier, and in many cases, it's more than one cause. Almost always, it's more than one cause. Simply treating the symptoms without addressing the root causes can lead to temporary relief at best, and at worst, it can allow the problem to persist or, in fact, even worsen. At our clinic, we offer a comprehensive approach to treatment. Our patients first go through a thorough consultation and comprehensive examination that includes a full spine nerve scan and diagnostic digital x-rays. This process allows us to pinpoint the exact sources of their pain, whether it's due to disc bulge, disc herniation, stenosis, degenerative disc disease, arthritis, or other spinal problems. Once we have a clear diagnosis, we apply targeted treatment methods designed to correct all of those identified causes, ensuring a more effective and lasting solution for our patients. Our cornerstone treatment method is something referred to as non-surgical robotic laser spinal decompression. It's exciting technology. What makes this approach unique and different is that it combines spinal decompression with class 4 laser therapy at the exact same time. It offers a targeted and highly effective treatment for back and leg pain. There are only 12 of these systems in the world. We're proud to say we're the only ones in Ottawa, Ontario, Canada. It's comprised really of two main things: spinal decompression, which gently decompresses the spine. It relieves pressure on those compressed discs and nerves. The process creates a negative pressure within the disc that encourages the retraction of herniated and bulging disc material. It promotes the flow of nutrients and oxygen back into the disc. It aids in rehydrating and healing the discs, restoring their height and reducing nerve impingement. Robotic class 4 laser therapy applied simultaneously delivers concentrated laser energy to the affected tissues. The laser therapy stimulates cellular repair and regeneration, reduces inflammation, and can increase blood flow to the area. This anti-inflammatory effect provides immediate pain relief and helps reduce muscle spasm and stiffness, allowing patients to experience greater comfort and mobility. As you can see, the class 4 laser comes right out from underneath the system and happens at the exact same time as the spinal decompression. It's the simultaneous combination of spinal decompression and laser therapy that uniquely enhances and compounds the healing effects. While spinal decompression targets the structural issues within the spine, the laser therapy addresses pain and inflammation. Together, they provide a synergistic effect that not only alleviates symptoms more effectively, but also addresses the actual underlying cause of the pain. Class 4 laser is the highest level of laser that's approved by Health Canada and the FDA. Patients often find this dual approach to be comfortable and highly effective, as it provides immediate pain relief while promoting long-term healing and recovery. We want a long-term solution to your problem. One of the greatest benefits is that it allows patients to avoid back surgery. You now have a concise guide about the meaning of a pinched nerve in the lower back, radiculopathy, and sciatica, along with some of the common causes of leg pain. In addition, you've learned about the new and revolutionary non-surgical robotic laser spinal decompression, which uniquely combines two research-backed therapies for enhanced healing and pain relief. If you're ready to take control of your pain and improve your quality of life, consider exploring the innovative treatment options that we have. If you have any questions about it, leave them in the comments below. Please like and share this video if you found it to be of value. And please remember to subscribe if you want more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and without surgery. The next video you should watch takes you through a step-by-step non-surgical treatment protocol for conditions like sciatica, disc bulges, and lumbar stenosis. Don't miss out. Watch it now for effective relief strategies.